Hi everyone, my name is Chris and I'm one of the orthodontic assistants here. Welcome to our family. I would just love to talk to you about little things about braces because I know braces can be scary. When you get home, things may happen and you don't know what to do, you don't know if it's normal, if it's not normal. So I'm going to go over all those things and hopefully I can answer all your questions. You're going to have some things in your mouth that may hurt, that may seem weird, like your bite may change. You may wake up in the morning, you may bite on the left side and not the right side and not the left. All this is normal. There's nothing that you should not experience that is really not normal for having braces. We do have some things that patients get concerned about, like they'll get these little colored O-rings on their teeth that holds in the wire. If one of them comes off, it's okay. It's not an emergency. I know to you it probably doesn't look good, but we can replace that for you. Just call our office and we can replace it. It takes like 2 seconds, but you do need an appointment for that. Another thing is we have these little steel ligatures that sometimes we wrap around the teeth, and these little steel ligatures can dig in your lip. Now that will hurt. So I want you to find a pencil at home with an eraser, take the pencil and just push that ligature up into the bracket, okay? You can use as much force as you need to just to push it up there, and that will comfort your lip so it won't cut your lip. If you got some soreness in your mouth because of like a little canker sore, in your little goodie bag we have something that's called Orabase. Orabase is like a liquid Band-Aid. You just open it up, you take a little bit out, you put it on that canker sore, and it will numb it up so you can eat and drink comfortably. And then lastly, when the teeth move, long ends grow in the back. So I have something in there called wax. You just take the wax out, you knead it in your finger a little bit, and you put it on the back side where the long end is until you can come see us and we can clip it for you.
Hey guys, I'm Rachel. So once your braces are on, your teeth are going to be sore that evening and over the next couple of days. Whatever you would normally take for a headache is okay for pain. Ibuprofen is really good because it also helps with the swelling.
Welcome into the family, and my name's Carla. We're going to go ahead and talk about wax. You usually use wax for braces whenever you have something poking along your lips or cheeks. What you want to do is go ahead and grab a piece of wax out of this little container that we supply in your bag. You want to go ahead and pinch off a little piece, but first you want to make sure that the area that you're putting it on is dry. So you go ahead and pinch off the piece and you put it over your bracket, just like that. And you just leave it on there. If you need it on for a long time, you want to make sure you dry it off first and then put it on.
Hey guys, my name's Lisa. Welcome to the practice. So I'll be talking about appliances. There's two different types of appliances. One could be in the roof of your mouth and one could be under your tongue. Everybody's going to have to deal with this, but it's going to make you talk a little funny for a few days. We don't want you to be embarrassed. A few ways to get around this is you can talk to somebody, you can sing out loud, or you can just practice reading out loud. That'll help you feel more comfortable when you're in public and when you go back to school. Also, it's going to catch a lot of food. Just know that up front and just take care of yourself, and we suggest you use a water pick to get it clean.
I have a couple items here that I'm going to go over because we do have a bad food list and a good food list. There are some foods that are bad that you cannot eat and some that are good that you can eat. So I have an audience over here, and I'm sure you're going to recognize some of the faces. They are going to help us to decide if they're good foods or bad foods. So here we go. Carrots, bite-sized carrots. Yay! My favorite, popcorn. No! I have two things here that are kind of tricky. I have a whole apple and a cut-up apple. Whole apple. No! Cut-up apple. Woo! How about some gummy bears? No! Potato chips? Yeah! Milk duds? No! So as you see, our orthodontic family, there are a lot of foods you can eat that are really good for you and that have a lot of sugar in it and that you would love to eat. And there also are bad foods that you cannot have that will break brackets. So thank you for joining us and have a great day.